Hi, good evening, everyone. Today, another ASPN interview with Dr. Dawn Chia. Dr. Dawn Chia is a senior consultant in hand and reconstructive microsurgery peripheral nerve at the Seng Kang General Hospital in Singapore. She holds MBBS from National University of Singapore, MRCS from Edinburgh, and Master of Medicine in Surgery. She completed her fellowship in microsurgery and brachial plexus in Japan. She has a clinical experience that spans hand and wrist trauma, pediatric hand surgery, paralytic limb reconstruction, peripheral nerve injuries, and disorder. As for her academic profile, she has authored numerous peer-reviewed papers on microsurgery, nerve repair, and rehabilitation, including novel virtual rehabilitation approach post-nerve transfer. She is also an educator at National University of Singapore and Nanyang Technological University Medical Schools, and she is actively contributes to the professional societies like Singapore Society for Hand Surgery. Hi, good evening, Dr. Dawn.
Hello, hi. Good evening, everyone at ASPN and Usama. Very glad to be here. Thank you for inviting me on.
Thanks, it's our pleasure. So today we are going to take our readers to a quite interesting topic, which about 3D modeling in nerve surgery, which I think you are quite interested, and I actually followed you for some of the conference. You had some nice presentations and cases you have presented. So let's start with our first questions. Uh, what inspired you to be interested in specifically in 3D modeling in nerve surgery?
Yeah, thanks for asking. Yes, I do find this a very interesting area. Not just, I wouldn't say that it's just for research, but it actually has many clinical applications. So we often do 3D modeling, 3D printing in a lot of our orthopedic work for deformity correction.
Yeah,
And
correct.
along the way, we also realized that 3D modeling actually allows us to review the anatomy of the area.
Mm.
And so my interest is in peripheral nerve and brachial plexus. And so, the brachial plexus area is actually quite a complex anatomical area, with a lot of different structures and tissues, which and can be quite critical. So when we look at the brachial plexus, it can be difficult to identify, especially if you have a tumor growing. And that is how I got interested in understanding anatomy by making it into a three-dimensional uh, figure so that we could walk through the entire anatomy. So, and by printing it out and really studying it in a three-dimensional aspect, you really have a better visualization of all the relationships of the different structures.
I see. Yeah, that's very interesting because I think all goes into the patient outcome and how you can plan for your surgery. So we move to our next question. Um, let's say you have a case that you want to do a 3D modeling for a nerve case. So how is the typical workflow starting from seeing the patient, imaging, 3D modeling, and all those things that you prepare for your surgery?
Yeah, so this is pretty much similar to how we would start off in preparing for any 3D print. We do undergo the same process of obtaining imaging sequences from the patient, either in both CT and MRI, and then we subsequently use the software to segment these images. And then after segmentation, which is identification of the separate tissue parts, we reconstitute it together and take away all the artifacts and noise, and the resultant picture that you get would be in a three-dimensional format. And
I
what
see.
is interesting is how all these three-dimensional formats can be reconstituted because besides exporting it into a file that can be printed in a 3D printer,
Mm.
we can actually deconstruct each tissue part to study each one in its entity. And also we can export it to use it in different formats, like putting it up as an augmented reality model and create holograms. So we can actually use an augmented reality viewer to study the anatomy and also do surgical planning and rehearsals for the patients before the surgery itself. And actually, the physical print and all these augmented reality and digital formats do help a lot in getting the whole team together to also educate the team and prepare for the case together. It becomes a teaching tool for the team and a good way to explain the anatomy and the surgical plan to the patient as well.
Yeah, that's very impressive actually, because it's usually for such cases the field is not that big. That's what you for your assistant or like for the team for everyone to have a look and see like in detail. So if you have a plan like this or like a tool that can help you to explain to everyone in your team prior to the surgery, this is really very helpful. It will help everyone to understand well.
Yeah,
Okay.
that's right. So actually, to get this whole process together, it is also a process that requires a lot of input from and a team in itself to create this three-dimensional model. So we do have a good team in our SingHealth unit. So our team consists of our radiologist who helps us to review the images
Mm,
and also advise on the type of sequences,
mm,
scans, and cuts that we will need. And we can also go through with them what are the surgical aspects that we are looking at so that they can also identify what is to be segmented when we subsequently do the 3D modeling. And as well as that, we have input from the 3D engineers as well in the laboratory who help us with the segmentation and the creation of all these different ways of modeling and the eventual printing of the model.
I see. That's very good because definitely this need a teamwork and not just a one-man show, of course. So how do you see this 3D modeling impacted your surgical planning and patient outcome for the nerve surgery?
I think if we look at the 3D modeling concept, it really helps the surgeon and the entire team to understand the anatomy around it. And so definitely this helps a lot in the surgical planning. But I think another important aspect is it really gives us an understanding of where the critical structures are, how the relationships are. So when we do the surgery for the patient, it is rehearsed and we have better accuracy and better planning in our approach. In
Mm,
fact, not only just in that area, that it helps to understand anatomy, even steps like if we had to do any clavicular osteotomy, we can also plan that ahead of time to know what are the exact size implants that we will need to use, where we will create our osteotomy, and all these help in uh in the patient's journey to better guide the accuracy of the surgery.
I see. So you think like by doing this, planning everything ahead, is it going to reduce the operative time? Because usually for brachial plexus, it's quite long surgery.
Mm, correct. So I think it does because
Mm,
you have already anticipated where the anatomical structures are. For example, your brachial artery that is in
mm,
very close relationship to the brachial
mm,
plexus. You have from your model already had a good idea and understanding where you would be expecting to see it. Things like your osteotomy, you can actually uh size your plate so you know what implant you're using. You can pre-bend it, and also you have planned where the osteotomy cuts will be instead of relying on table
mm.
assessments. So all these will add up in terms of the time that is taken for you during your surgery.
And from your experience, do you think that there is some imaging modalities like MRI or CT that is more sensitive for creating this 3D reconstruction, or it really like based on case-to-case scenario?
That's a very interesting question. So you're quite right that the imaging modality does impact a lot on our eventual model. So originally, a lot of the 3D printing was based on CT scans. And as we know, the CT scans are very good in identifying the bony structures. And that's where the original and most popular use would be to correct bony
Mm,
deformities.
correct.
uh, as we move on, for nerves, we don't pick it up well on the CT. And so most of the time, we are using the MRI. And I would acknowledge that the technology for MRI for the nerves in terms of a neurography is also still in a process of a lot of development. And so having very fine cuts and very precise MRI imaging of nerves is still an area that it has a lot to develop. And so if we think about MRI as well, it is a and type of imaging technology that the patient will need to undergo, and it takes a while to get the sequences.
Mm,
And with every decrease in the amount of uh what do you call it, the distance between the cuts
mm,
decrease, the time taken for the MRI also increases. And so we are trying to find a balance between that, to get a fine cut with good image of the nerves, and also to decrease the patient discomfort in the MRI machine. But we do have a lot of good radiologists and a lot of research going on. And actually, the imaging sequences have been improving a lot until now. We can also see things like the fascicles, anatomy,
wow,
and slowly, I think all these will gradually translate into better imaging, which will also result in better segmentation and eventual 3D modeling for all these patients.
I see. Yeah. So do you come across 3D printed nerve conduits and during your practice?
3D printed nerve conduits, that's a very interesting, very relevant topic actually,
Mm,
because whenever we talk about nerves,
mm,
and where I started, this is about tumor surgery.
mm,
So we are thinking about removal of a segment
mm,
of a possible removal of a segment of nerve,
mm,
and that will give a resultant gap. When you have any nerve gap, the next question would be, how large is the gap? Will we need to fill up the gap? And that's
mm,
where all these nerve conduits, nerve grafts come in. So, having interest in 3D printing, it's very natural that there will be an extension into 3D printed nerve grafts as well. So the idea of 3D printed nerve grafts is not new. It has been around for many years, but I would say most of the 3D printed nerve conduits are limited to laboratory research. There are a lot of different laboratories that have started, and there are a lot of different materials also. So we're talking about not just nerve conduits made from natural materials, but also 3D printed biocompatible materials. So it can be in hydrogel format, it can be in a more structured scaffold format. So all these have already been under research. However, I think the translation to clinical use is still in a investigative phase. So that still remains to be seen, but definitely is a good field and very exciting
I
to be looking out for.
see. Yeah. So, usually when you start a new service or adopting a new technique or new technology into your field, especially in the medical industry, sometimes, most of the time, you face some obstacles or some barriers that you have to push it. So have you came across such thing when you try to start this 3D modeling for the nerve surgery?
Yes, you're quite right. There are a lot of regulations that go on within the industry, especially in healthcare, because all these affect patient outcomes, patient safety. So regulations are in place. The thing about 3D printing is most of it are physical formats or digital formats, and that does not directly go into the patient. So these are very useful for the surgeon to help them to guide them in the surgery. In terms of adoption into use within the patient, I think there 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 are still a lot of areas where regulation and technology needs to be addressed. So, for example, when we want to use it intraoperatively, 3D printed models, we need to know whether will they be used as a guide in the patient or whether they will be implanted into the patient, because those will also come up with different regulations. And the intraoperative use of all these 3D models, sometimes we also need to pair it up along with other existing technologies. So, such as if we wanted to use 3D printed models, we will need to sterilize them first before we bring it into the OR. So, are they compatible with our sterilization equipment? Is the biocompatible uh, material compatible with our patient and also our equipment. So these are things that we need to think about as well when we do the surgery. And on top of that, we do need special requirements and permits in order to put these 3D printed implants into patients.
Let's see. And usually for if you have a case that you want to plan for a 3D modeling, usually the whole process, how long does it take to prepare the 3D model?
Mm, that really depends on how complex the surgery is intended to be and how complex we want the model to be. For example, if we had a brachial plexus tumor that requires us, that's very extensive, for example, and it's extending from the roots all the way retroclavicular into the axilla, and we wanted to print out everything about the tumor, about the nerve, and also its relationship to all the brachial artery and the clavicle. The entire process, it will, need to have a lot of segmentation and printing. So that can range and can take a couple of weeks in order for you to print out and also to rehearse and and get your implants to be ordered and to be um what's the word
Ready
for it?
for the
To
for
be ready for the surgery.
mm,
Uh the if we decided that we don't need all the rest of the information, for
mm,
example, if I just wanted to see the tumor on a digital file. So
mm,
I can access it on my computer. I
mm,
can rotate it and study it and look at all the different tissue layers
mm,
on my computer.
mm,
And I don't need it all printed out. I might just select to print out just the clavicle and the
mm,
tumor in
mm,
itself. And so I can just plan where my osteotomy cuts will be.
mm,
And that will reduce a lot of the preparation time and
mm.
the printing time for the model.
I see. Yeah, because I think also for tumors, the time, I mean, it's quite time sensitive.
Yes, that's right.
Mm,
So it does take time, but we have a very hardworking team. So if we tell them that, we have a case as urgent, they do work on it, and I really applaud them for the enthusiasm that they show and the dedication that they have to making our healthcare work for the patient.
yeah, I mean, back to the same point, it's need really a good teamwork to work on such thing. Yeah. Okay, so what do you think about the augmented reality and those 3D printing? Like the whole process, is it uh, quite expensive for like most of the hospital to adopt such things, or like is it easy to get? So like sooner or later, most of the hospital will adopt such thing in their policy, or how do you see it like from the financial part? Because usually also the hospital administration, when it comes to new technologies, new things, they are open to it, but usually also they are a bit concerned about the financial part.
Correct. So I would say that at least in my hospital, we
Mm,
are very encouraging for all these new technologies. They have been very supportive of 3D printing, and we do have a 3D printing laboratory in our hospital.
mm,
And we have a good network of interested surgeons and radiologists and the engineers who help us with this. So in terms of cost, I think in at the start, there are costs incurred. Um, these costs we do pass down to the patient, for the preparation and the printing of the models. We do try to make it affordable for them. And so, like just now I mentioned, if we feel that we don't have to print out as much, then we could limit as well what we wanted to print for them.
mm. Yeah, it's good also to have this kind of sense of the patient financial situation also. Okay, so we almost done. We are just moving to our last question. So, do you think now with the AI being quite deep into the medical industry, like how do you see the future of development with the AI and bioprinting and the 3D modeling for the nerve surgery?
Yes, that's another very good area that we should explore. Uh, AI has developed and is really progressing very fast. It can be very helpful in a lot of ways. Uh, I do hope that AI can be incorporated into all our future 3D printed projects, in terms of, when we look at the deformity or the area that we want to reconstruct, that AI can help us to make calculations, come up with an ideal shape fit. And also, this AI can eventually have a sort of understanding of the entire process of what we need for our surgeries. In terms of, another area would be just now when you mentioned things like modeling, things like eventual, forming of nerve conduits. Maybe one day AI can also help to guide nerve regeneration, or at least help us in our planning
Mm,
for how nerve regeneration models can be in future as well. So that will be an amazing area.
yeah, who knows? Maybe a couple of years later, we would be interviewing you for that. Okay, so this was our last question, and thanks so much for your time and for all the information. I think this is very exciting topic and very interesting for everyone to know, and a very new area also for the people to explore into the nerve surgery. Thanks so much, Dr. Dawn.
All right. Thank you very much for inviting me as well. Had a great time. Thanks.
Thanks. Have a great night. Bye.